Good afternoon, and thank you very much, everybody, for joining us in this powerful educational Lunch and Learn, which is brought to you by Family Partners of Morris and Sussex counties. Right here, this is your host, Patricia Houston, and I'm here with Katie Stewart, who is a public health educator. Welcome, Katie.
Thank you very much, Patricia. It's a pleasure to be here. As Patricia said, my name is Katie Stewart. I work at the Somerset County Department of Health, and I'm a public health educator, and I'm also the Morris-Somerset Regional Chronic Disease Coalition Coordinator. The regional chronic disease coalitions in the state of New Jersey focus primarily on cancer prevention and screening and quality of life and cancer survivorship. I've been working in public health for about 10 years. Prior to that, I worked at a cancer center just in Philadelphia. And so it has been my passion to think about cancer and to inform people about cancer risk and cancer prevention and getting screened. So today, I'm going to talk to you about finding good health information and helpful health information online, and also accessing resources as it pertains to cancer. Of course, many of these principles can apply to other chronic diseases as well. So I'm going to share my screen now.
And while Katie is sharing the screen, I just want to remind you that you can have access to this information in relation to link, contact information, website, and everything is going to be in the description box below the video. So if you have any question, all that information is going to be there.
So as I said, we're going to look at how to find good and helpful health information and resources online, looking beyond just searching on Google with a focus on cancer. And the reason I'm presenting this information today is so that you can figure out which information to pay attention to when you run across it to help you make the best decisions for your health and the health of your loved ones. And part of this involves understanding where the best places in the virtual environment you can go to find accurate and trustworthy information. So we're going to be looking at that in the first part of this presentation, looking at assessing online health information, looking at some examples of trustworthy sites. And then at the end, I'll be providing you a lot of information and resources that you can access if you or your loved one has cancer, including the American Cancer Society and other organizations that give resources, maybe support for prescriptions, financial support, transportation, and other accessories. So I think we can all agree that there is a lot of information in our environment right now, and we can really access all this information 24/7. But it is very important as we consume all of this information to have some tools to be able to know what is accurate information and where to find trustworthy and verifiable information. How do we know it's true and trustworthy? And how do we find it when we need to find important health information, for instance? How do we look for and find that true and trustworthy information, especially when we really need it? So the first thing that we need to think through is who when you have a website or you're on social media and there's a link to information, we want to think about, well, where is this website coming from? Who is managing this website? Who looks over it? And so there's really 4 categories of the types of websites that are out there. The first is a .gov. So in the address of the website, at the end, there is an extension, and it'll be .gov for governmental agencies. .edu in the extension refers to websites that are run by educational or academic institutions. .org are organizations that are nonprofit organizations, for example, or medical organizations, research societies. And then .com are commercial websites or businesses. So we're going to look at each one of these. Let's think about the government websites or .gov websites. Now, federal and state government agencies are accurate sources of information, as well as your local government. So for federal government, here are 2 examples of websites that have good, accurate information. The first one is the National Institutes of Health. This is the nation's medical research agency, and it is part of the U.S. Department of Health and Human Services. If you click on the Health Information tab, you'll find a wealth of information. And I've given the link right here. And I talked with Patricia before I started this presentation, and I'm going to do a list of all the links so that when you're viewing this presentation, you can look at those links and go to those links yourself. The second one is the Centers for Disease Control and Prevention, the CDC. And you may have heard of that, especially during the pandemic. So the CDC is the nation's leading organization to protect the public's health. If you click on health topics, you'll find information on almost any topic you can think of on the CDC website. If you would like to know all the federal government websites, and there are very many, you can go to www.usa.gov, and that will give you a list of all the federal government websites. The State Department, the New Jersey Department of Health, NJDOH, their path is here, www.nj.gov/health. They have also a lot of very good information. So I would encourage you to check out their website. Now, for educational or academic institutions, you might think, well, I didn't go to university, or I didn't go to these universities, so, they don't have any information for me. But actually, a lot of universities have information that's geared towards patients or their caregivers or family members. So George Washington University has a cancer center, the GW Cancer Center, and they have a webpage devoted to patients with a voluminous number of topics. So if you click on this link here, this is for patients and families. Now, Harvard Medical School, which is part of Harvard University, has a side group underneath the medical school called Harvard Health Publishing. And if you click on this link, www.health.harvard.edu, they give a variety of information on a lot of different diseases, including cancer topics. And they gear the information for people like you and I. So this is just two examples of, if you see an academic institution with .edu in the path, then you know, oh, this might have some really helpful information for me, because sometimes they post on social media. So nonprofit organizations and medical research organizations have also great information, and their extension is usually .org. And the American Cancer Society is a wonderful resource. If you or someone you know has cancer, I very much encourage you to go to www.cancer.org. And there's so many, you got to realize too that cancer is like many, many, many different diseases. So if you go to the American Cancer Society, if you have prostate cancer or breast cancer or whatever kind of cancer you have, you can click on that type of cancer and find out a lot of information. Some of the nonprofit organizations focus on a specific type of cancer, like the Colorectal Cancer Alliance. And the link that I gave you here goes right into colorectal cancer information. The American Lung Association is another example. This gives a lot of information about all different kinds of lung diseases, including lung cancer. And their website address is www.lung.org. Now, if you search for these organizations in Google, some organizations might actually have a special donate site. So for instance, the American Cancer Society has www.donate.cancer.org. And so if you do a Google search, that might pop up at the top of the list. So I just encourage you to scroll down until you get to the main page where you find the main path of the website. Now, health information can also be found on some commercial websites or businesses. And one example is a drug manufacturing company. And if you are taking a medication from a drug manufacturer, you might want to go to their website and find information. Just keep in mind that the information on this website may be geared more towards those things that they manufacture or produce. And so Bristol Myers Squibb at www.vms.com actually has a patients and caregiver site. So you might find the information there helpful. WebMD is, you don't want to go to .com sites for health information because they might be biased. Now, WebMD is the exception, and I've given you 3 links to webmd.com because the second link tells you about their policies and who they are and how they get their information, and the information there is trustworthy. They have many health topics, and they have experts in the field like doctors and physicians. So now you want to think, like, you're on social media, say, or a friend of yours ran across some information and you come to a strange website you've never seen before. How do you know that information that is in front of you is trustworthy? Well, I can give you some clues to help you figure that out. So the first thing you want to think about is what I said before. Who is the owner? Who's in charge of the website? Who are the experts? Do they have sponsors that pay for the website? And what is their purpose? So if they just say generally the website is run by individuals and businesses with an interest on the topic and they don't list who the people are, that's a red flag. So you might want to consider going to another more trustworthy site like the examples that I gave you just a few minutes ago. Now, if their purpose is general, for instance, maybe the website has to do with heart disease, and they say they want to give the public heart health information to offer related services. Well, then you want to ask yourself, well, who is it that's giving this information? Who is providing the information? What are the related services? And always ask yourself, is there some bias? And especially you want to ask these questions before you actually share anything that you run across online or on social media. The information quality on the website may be something you want to think about. Is it accurate? What is the source of the information? On trustworthy sites, a lot of times the authors will refer to science or research that was done, and they might quote the actual research paper, or they might quote some facts and figures that you can find on the census through census data or the National Cancer Institute data. You want to find out, is the information up to date? Did they review the website 7 years ago? A lot has happened in 7 years. So you want to make sure that the data that you're looking at is current. And is it emotional? Is it evoking emotions, whether it be anger or sadness, or are they trying to say something that sounds too good to be true, like some kind of miracle cure? And personal testimonies can certainly be effective and helpful, especially if you're going through a difficult time and you're reading about someone who maybe has cancer also, or another disease, if you're doing research on another disease. But you just want to be cautious because not everyone is the same, and how something affects one person may not be right for another person or for you. So if the website is focused only on personal testimonies, you want to go to those websites that have good factual information. And finally, when we think about privacy, we talk about this a lot today because we do live in very much an information and digital age. So you always want to ask yourself, what are they going to do with my information? And is there a way for you to contact them if you have questions? If they're asking you for information, they should have contact information so that you can contact them where they, and if you have questions about the information that's on the website, you should be able to contact them. You may notice when you open up websites that often there will be a pop-up that talks about cookies. And cookies enable a website to collect and remember information about your visit. And it actually can improve your website experience. So if you're comfortable with them storing your information, by all means, accept cookies. If you're not, you don't have to accept cookies. So those are just some things to think about. And as I mentioned before, if someone is visiting a site and perhaps, for example, an ABC company is sponsoring the site, well, ask yourself, are they selling a product? Are they only promoting their product? Does that company have an interest in you buying their products? So maybe the information on there is biased. Now, some sites have an online shop, and doesn't necessarily mean a bad thing. Perhaps you're looking for supplements, so you want them to have an online shop so you can buy a supplement. And for instance, the American Heart Association, which has a lot of good, valuable, and factual information, they have an online shop. So it doesn't necessarily mean that it's bad if you see an online shop, but you just want to ask yourself if the health information on the site is biased based on the products they're selling. Now, I just wanted to mention this, that a lot of online scammers target older adults. So if you have relatives who have been targeted by online scammers, there is a national elder fraud hotline at 833-FRAUD-11 or 833-372-8311. And I've also provided the link here, which I will include if you're looking at the recording, that you can contact them and they can help you or help your loved one if they've been scammed online. So now that we have sort of a backdrop of how to evaluate the health information that you're looking at online, I do want to address this age that we live in where there's a lot of misinformation and disinformation, and to kind of talk about what is the difference between those and how do you avoid misinformation and disinformation? So misinformation is incorrect or misleading information. And the misinformation is usually spread unintentionally. In other words, the person didn't mean to give out incorrect information. So if a situation doesn't have a lot of clear details, when you think back to the beginning of the pandemic, there was a lot of unknowns, a lot of things we just didn't know about this virus. It was brand new. Or say, for instance, it's an emergency, like a major storm, then misinformation can easily be spread. So for instance, like if it's at the beginning of a storm and the power goes out and it's really raining or snowing, we might not know the whole big picture of the impact of that storm. So making decisions based on a Facebook post might not be the best idea. Now, if the Facebook post is from local first responders or the state police or the state office of emergency management, then you would want to follow what they're posting. But you just want to be cautious. What happens in one household may not be the picture all over. So misinformation is not obvious. It's not obviously wrong, but it may be partially true. Disinformation, on the other hand, is false information that's deliberately and sometimes covertly spread, like the people who are trying to distribute disinformation may actually do it by planting rumors. And the purpose of disinformation is to influence public opinion or obscure or hide the truth. So, for instance, in a war, one side might want to influence the other side. Maybe they're hoping that the leaders will lose support and they'll put out information that might look true, but is totally false. So disinformation is given out intentionally or on purpose to sway people a certain way. Misinformation and disinformation are more likely to spread in a population if there's a lack of accurate information available. And also, number two, if there is a mistrust in leaders and institutions. Unfortunately, research has shown that communities of color are often the target of misinformation. So, if you would like to learn more information about how to discern fake news, how to identify when something is not quite true or partially true or totally false, these are two good links. One is Johns Hopkins University has a library. And if you go onto this link, it's called Evaluating Information, Info on the Internet. And they have some excellent videos which talk about how to check whether information is accurate or not when you run across it. And the NIH, or the National Institutes of Health, the National Library of Medicine, has a great link, and it's a tutorial. And I use some of the information here for this presentation today. So I just want, as you think about, wow, there's so much information out there, and I've tried to give you some good sites that you can go to that have accurate information, and also to help you realize that there is information out there that is misinformation or disinformation. Something to keep in mind. There's actually a science of communication. And some of the things that they have learned as they've studied communication is that we're more likely to believe something is true if it's repeated often. So whether the message is true or not, it could be that the sky is purple and you keep saying over and over that the sky is purple, we're likely to believe it, even though it's totally false. And if the message is easy to understand, we're more likely to believe it. And it has to do with how our brains attach to messages. So also, if someone comes along, okay, so say someone said something about the sky being purple, and someone came along and said, no, the sky is blue. Well, the correction of the misinformation, it doesn't erase the original message from our brain. We still remember the message that the sky was purple. And so that's why it's difficult to change minds when someone comes and corrects misinformation. It doesn't change the fact that the original message was false. It's just how our brains work. And it's also very easy for us as humans to believe misinformation if it confirms or supports some view or perspective we have. So all of this makes it difficult to sometimes navigate all the information that we have out there. And that's why it's important to try to go to websites where we know the information is valid and accurate, like the .gov website or .edu or .org. Now, I wanted to try to give you, I'm going to give you a lot of information right now. And as I mentioned, I will list this information so that when you are watching this, you can go to the list to look at these resources yourself. The National Cancer Institute, NCI, that's what NCI stands for, has a list of really very many resources that are available for cancer patients and their families and their loved ones. And if you use this QR code, it'll bring you right to that page where you can look at these resources. I'm just going to highlight a few. And I'm going to start with the American Cancer Society. And the reason that I'm giving these resources is a lot of times, people, they hear this diagnosis, which can be very devastating, and they just don't even know where to turn. So I hope that you're not touched by cancer, but if you are, or someone you love is touched by cancer, these are the kinds of resources that you as a loved one or you as a patient can access. So the American Cancer Society, this is just 6 of the many programs that they have. The first is a 24/7 cancer helpline for people dealing with cancer. And you'll speak with a trained cancer information specialist, and they can answer your questions and give you guidance. Rides to treatment, you might be able to get help for a cancer-related medical appointment, but you do need to call well in advance. The Tender Loving Care Program gives help for patients with hair loss and mastectomy products. ACS Cares is for people who are newly diagnosed. They just were told that they have cancer. It's for patients and their caregivers, and they give information and support, especially in making the many decisions you must make at the very beginning of being diagnosed. And for instance, if you need treatment away from home, they may be able to help you financially or help you with lodging. Like they have a Hope Lodge program and Extended Stay America, and they can offer patients discounted rooms. Cancer Survivors Network is a peer support community for cancer patients, survivors, caregivers, families, and friends. And Reach to Recovery is a website and an app, and you're connected to someone based on diagnosis and treatment options. So what you're doing is they match you, like for instance, if you have a certain type of breast cancer, and you're going to be treated a certain way, they'll try to match you with someone who also was a breast cancer survivor who had that same treatment. Now, these are other resources not connected to the American Cancer Society, the Cancer Hope Network. You can also get matched to trained volunteers. Cancer Care provides counseling support, education, referrals, and help with financial copays. Cleaning for a Reason Foundation is a wonderful organization that provides cleaning services for cancer patients in treatment, or if they've had surgery, or if they are on hospice. Triage Cancer, they give education and information on finances, insurance, careers, and the legality associated with cancer. They don't give legal counsel, but they do give education about it. And I am planning a presentation from Triage Cancer in April, so stay tuned for more information on that. Good Days gives support for diagnostic testing, copay assistance, travel assistance, and premium assistance. They have a limited number of diagnoses available. When I checked the website, the last day I checked it was December 13th of last year. The HealthWell Foundation also provides financial support if you meet the eligibility criteria and have an eligible disease. And it doesn't necessarily need to be cancer, so you might want to check these websites out. PAF Copay Relief gives financial assistance for prescription copays, coinsurance, cost sharing for qualified persons and diagnoses. And Mercy Medical Angels, again, it's a variety of diagnoses, not just cancer, but they'll give free on-the-ground and in-the-air medical transportation for non-emergency visits if you qualify. And these are more, again, these are other organizations related to cancer. And I'll just run briefly through these. This is not an exhaustive list. I just wanted to give you a flavor of the organizations and support there is out there for people who suffer with cancer. The National Breast Cancer Coalition is the largest breast cancer advocacy group in the U.S. Living Beyond Breast Cancer is a national nonprofit that connects people with trusted information and a community of support. The National Coalition for Cancer Survivorship is a survivor-led advocacy organization. And there are many organizations that focus on a specific type of cancer. So Zero the End of Prostate Cancer is one of those. Sharet is for Jewish women and families living with or at increased risk of breast and ovarian cancers. Sisters Network, Inc. is a national African American breast cancer survivorship organization. And the Young Survival Coalition is for young women with breast cancer, 40 years old and younger. And it is local, national, and international in its reach. And finally, I just wanted to give you, let you know that there are resources close to home as well. And one of those is Crossroads for Hope in Bedminster. And they have wonderful emotional, social support, educational workshops, nutrition and healthy cooking, mind and body sessions. They give support for families, including children and teens, and they have community-based resources. They have a free mobile engagement tailored program called My Go-To Support. So I encourage you to check that out. Also, and this is last, but certainly not least, if you or your loved one is at a treatment center, often there are many good and very important services available right there. And you can start with social work services. All you have to do is ask, do they have a social worker on site? And tell them you would like to meet with them. They also might offer education program or support groups. And by all means, talk to your providers about your needs. For instance, even if it's something that seems unrelated to cancer, it definitely has an impact on you and your health. For instance, if you're having trouble getting food, you're having trouble with your housing, be sure you talk to your physicians or your office staff, because it really affects how you will go through treatment, or how you will heal. So I really encourage you to use the resources that are there, and don't hesitate. That is why they're there, and they want to help you. So I hope this gives you a taste and a flavor of how to sift through the amazing amount of information that we have at our fingertips, that certainly 20 years ago or 30 years ago, we certainly didn't. So thank you very much.
Thank you very much, Katie. To be honest, I'm amazed with the information that you brought here today. I know a lot of families and providers are going to benefit from this. So thank you for, having this topic in here and sharing all those links and all the information that I'm sure not a lot of people know about it. So thank you.
Oh, you're very welcome. And here's some more references too.
Thank you. And as I mentioned at the beginning, I'm going to add all the contact information, all the links and everything is going to be in the description box below the video. So if you have any questions, all that information is going to be there. Thank you.